You come to the ASIS, your patella, lateral malleolus, lateral epicondyle, graded trochanter. Okay, go to the lateralmost side. That's all you need to know. So you do. This is our stationary arm. So if you're doing, okay. So if I'm doing abduction, just give me an example. So you're going to be ASIS to ASIS. It's pretty simple. In middle, if the patient is rotating, just kind of bring it, stabilize it, so that you can go outside. Okay, so we're going to do hip flexion. So in this case, ours is in line with the body. Okay, so graded trochanter. This is my stationary arm again. In line, there's a little bit of approximation. In line with this middle of the thigh. And I'm just going to give it a bend. You have to do a little bit of adjusting. Come, you can bring it. There you go. And that's about it. It's full range.
So you want to do like passive range of motion for them?
Mm-hmm.
Okay.
Yeah, usually passive is a little bit more than active. Do you remember that?
Mm-hmm.
You can kind of press it. So you can kind of press a little bit and go. Some of them are good. You know it's full range. And the extension, So, so extension, can you go to your... Okay, so in this way, extension, right? So this way, the same way, and go up. Okay, so this is basically, you just go like that. You bring it in. So a lot of times, if the patient is hiking the hip, you have to do a little bit of adjusting. They're hiking the hip, you kind of want to, some of them they hike the hip, right? So go back up again. Adjust it. That's basically it, guys. Right? Come back. Right? Relax. Then you go to your back. So that is your flexion extension. Are we doing good? Fittery is awesome book for this, lowers, okay? Again, lots of ways of doing it, but we'll just show you. So your ASIS. So ours, in line. If the patient is rotating, bring it, move it a little bit. Okay. Make sure it's in 90 degrees, and can you come outside? If the patient is wearing jeans, I don't think they're going to have full range. You know that, right? Okay. So just like, just go. So just, that's basically it for your abduction. Okay. For adduction, this is what I was saying. You kind of move it like that, and go. And some of them will do, it's okay, but you are bringing in the rotation part into it. It's kind of confusing. So that is why we move this one out. It's fine. Come back. Is it not 10 minutes yet, right? Same way, right? Go 90 degrees. Move this way down. Possible. Can you bring it in? And just go. As far as you can go. Right? So we did. Can you sit on that way? Facing. No. Sit with your feet down like that. So did we did abduction, adduction, flexion, extension. Then we need to do internal, external rotation. Alright? So, can you come a little bit? No? Okay. Go back. A little bit. Okay. So, you can actually put like a towel or something here. So technically, so that way, because when you sit, it's kind of comes like that. This way, it's up like that. That's the only reason. Have a towel there. In one of those. If not, we can manage. It should be in one of the cupboards. No? Okay. Can you go back tiny bit?
I've got my sweater.
Is it okay?
Mm-hmm.
So, this way, our central patella, tibial plateau. Again, many ways of doing it. You can do, I find it easier to do like this. But you can do it like this, fine with me, right? But make sure you're holding the stationary arm. That's all. Stationary arm, you do, and I will hold it in 180, in line, and then I want you to bring it in. And that's it. You go 45 degrees or whatever it is, come back. Now, can you move your foot this way? You have to kind of adjust a little bit, that's okay. There is a little bit of rotation involved, that's okay. 45, 50, something like that. That's it, simple. Can you go on knee flexion? What position did they show knee flexion on that? Is it? It's prone. Prone. Okay? Again, extension we don't do unless patients have some hyperextension. We typically don't do. Alright, so we don't need to worry about it. And if you want, again, you can put like something here to keep it straight. Thank you. So, same way, lateral and middle of the knee, and can you bring it? Bend all the way. And that's it. The only thing which will stop is soft and feel. That's all. Right? Extension, no. That's it, right? Range of motions, you're done. Range of motion, pretty simple, guys. The only way you're going to get confused is